Thanks, everybody. We'll get started now. Today's presentation, Yoga for Health in Parkinson's, will be presented today by Danielle Nardi, and I'll introduce Danielle in just a minute. Next slide, please. My name is Bill Patjane. I'm the Executive Director for the APDA of Massachusetts, and welcome to today's presentation. The APDA of Massachusetts has been in operation for decades and offers programs and services to the PD community in Massachusetts and surrounding states. We actually have chapters throughout the entire US. We've received a large response for today's presentation. There's been a tremendous amount of progress understanding and treating Parkinson's disease. PD is highly individualized from person to person. Not all that is discussed today is relevant to everyone. The healthcare team must be familiar with the signs and symptoms, treatment strategies, and how PD impacts the individual patient. Treating PD well requires a team approach. Today, we are providing information, and it is not intended as medical advice. Today, we will be taking questions and answering those questions at the end of the program. Please feel free to type your questions into the Zoom Q&A box. We will try to get to answer as many as possible live at the end of the presentation. The Q&A button should be at the bottom of your Zoom screen. Today's presenter, Danielle Nardi, is Doctor of Physical Therapy and Advanced Clinician in Physical Therapy. She works at Spaulding Rehabilitation Hospital in Hyannis, Massachusetts on Cape Cod. She provides physical therapy services for Spaulding of Cape Cod. Danielle's education includes Quinnipiac University, where she got a Bachelor in Arts in Mass Communications. Additionally, Massachusetts General Hospital Institute of Health Professions, where she got her doctorate of physical therapy. Her clinical interests include neurological conditions, cervical pain and headache, incorporating yoga into therapeutic treatment for overall mind-body wellness. She is a certified yoga instructor. And so without further ado, I'd like to turn today's presentation over to Danielle Nardi. Thank you, Danielle.
Thank you so much, Bill, and thank you to the APDA for having me. As Bill mentioned, I'm a physical therapist and yoga teacher, and one of my passions is being able to share the health benefits of yoga with different individuals that I might be treating in a therapeutic way. So today we're going to talk a little bit specifically about yoga for health in Parkinson's, and we can flip over to the next slide. So some of the things that I hope to cover today are introducing you to the practice of yoga and discussing the benefits of yoga, specifically how they can benefit individuals with Parkinson's disease. We're going to talk about different types of yoga because there are many different types of yoga. So I think it's important to understand which ones might be most appropriate for what you're looking for. And then we're going to talk about how you can identify the best type of yoga, class, and teacher for you to begin a yoga practice if that's something that you're interested in. So let's just start with a quick review. What is Parkinson's disease? So Parkinson's is a neurodegenerative disorder that affects specific areas of the brain called the substantia nigra, and it's predominantly responsible for producing the neurotransmitter dopamine. So why is this important? Dopamine helps to regulate movement, which is why many of the effects or symptoms that we see related to Parkinson's are what we call movement or motor related symptoms. We can go to the next slide. So some of the most common or recognized symptoms related to Parkinson's disease are tremor, rigidity, which is tightness or stiffness of the limbs or the torso, and often that can result in what we call a forward flexed or rounded posture. Bradykinesia, which is a slowed movement and often has challenges with fine motor coordination, so writing and anything that you're going to be using fine motor skills. And postural instability, which is balance. So difficulty in balance, and in Parkinson's, we often see it what we call retropulsion or backwards, the tendency to fall backwards. All of these together can contribute to difficulty with walking or gait. So with individuals with Parkinson's disease, we often see a decrease in the gait speed, a decrease in arm swing when walking, and a decrease in trunk rotation, decrease in step length, so short shuffling steps. And then we often see freezing of gait, or that feeling of not being able to initiate or start your gait, feeling stuck. So those are some of the most common motor symptoms of Parkinson's disease. And then there's also non-motor symptoms. Some of the most common non-motor symptoms with Parkinson's disease are depression and anxiety, a feeling of lightheadedness, pain, and difficulty sleeping. So we're going to talk a little bit about what yoga is, and then we're going to tie those two things together and talk about how yoga can help address some of these symptoms. So yoga, the word yoga comes from a Sanskrit word that means to yoke or bind together, the word union. And so when we're talking about yoga, what is it that we're uniting or binding together? Oftentimes it's breath and movement. So in yoga, oftentimes we will link breathing with our movement, or the body and the mind. So it's not thought of as just a physical movement practice, but linking the body in with the practice of mindfulness or meditation. Now, yoga is a practice that was developed thousands of years ago in India, and the original intention of the physical yoga practice, so the yoga poses that we most often think about today, was to prepare the physical body and the mind to sit in long periods of meditation. So you were really loosening up, stretching the body, calming the body and the mind to sit in meditation. That was the original intention of the yoga practice. We can flip to the next slide. So more specifically, what is meditation? So meditation is a technique that cultivates mindfulness. Now, mindfulness is the act of intentionally paying attention to and accepting the present moment in a non-judgmental and curious manner. So one way I like to think about it is we think of physical exercise being good for our bodies because you get the benefits of strength and endurance. Meditation can be thought of as exercise for the brain, and the mindfulness is the result. And similarly to how exercise can give us the result of strength. It also helps to build endurance with that idea of mindfulness. And so a really good example, if you're not sure what it means to be mindful or present in the moment, is when you're driving your car someplace and all of a sudden you're just there and you're kind of like, wow, I don't even know how I got here. I didn't pay attention or recognize anything as I was driving along. You're on autopilot and you just kind of end up there. You weren't really mindful. You weren't in the moment. Your mind was making your shopping list for later, thinking about what you're going to have for lunch or something that happened yesterday. You are in the past, you're in the future, but you're not really in the present moment. And that's what mindfulness is that idea of being in the present moment. So what are some of the benefits of yoga? There are a lot. So with a physical practice of yoga, we often see increased flexibility and range of motion, so of the muscles and of the joints, increased strength, balance, coordination, posture, improved breathing, and they can also help with pain management, stress relief or relaxation, and there's even some immune system benefits that we can experience through a regular yoga practice. So one of the really interesting things being a healthcare provider who's interested in the practice of yoga, and especially incorporating the practice of yoga into my therapeutic treatment, is the research that's currently going on with yoga. So if you search PubMed, which is a research database that we often use in healthcare, back in 2013, if you put in the word yoga and we're looking for some good research, you would have gotten under 400 articles. Today, if you put in the word yoga into PubMed, our research database, you'd get over 5,000 articles talking about the actual research benefits of yoga. The really interesting thing is that there's even insurance companies that are starting to pay for some of these studies, which is great because that means they're starting to really understand and believe in these benefits, which is going to make it more widely accepted to incorporate them into healthcare practice. So this is just a survey. So this wasn't specifically a research study, but it was a survey that was done on individuals who practiced yoga in the US and their perceived or reported benefits that they got from it. And some of these are really impressive. So you can see 86% of people said that a yoga practice reduced their stress. 67 said they felt better emotionally. 59 said it improved their sleep. 63% said that it overall motivated them to exercise more regularly. And 82% said that it just improved their overall health and made them feel better just from a yoga practice. I think these are some really exciting numbers to see to really support the benefit of a yoga practice. So who can do yoga? This is a great question. I believe anybody can do yoga. If you can breathe, you can do yoga. And then the number one comment that I hear from people is that they say, yoga, I can't do yoga, I'm not flexible. And my response, and this is a quote that I got from the founder of the Accessible Yoga Organization, is that yoga is not about having a flexible body, it's about having a flexible mind. So you don't need to be physically flexible to participate in yoga. You just need to be open to trying something new and exploring the benefits that you might experience with this new practice. And I also like to say that I personally, my favorite thing in teaching yoga, I like to teach people who feel like or think that they can't do yoga. I love that challenge of introducing people to this practice and getting to help them experience the benefits. All right, we can go to the next one. This is just a quick slide showing some of the different people that practice yoga. As you can see, we have a wheelchair user, there's children, there's adults, there's two different amputees pictured. One is practicing with prostheses, one is practicing without. So really the beauty of yoga is that it's highly adaptable. We can make it accessible to anybody that's interested in practicing. So this is just a quick visual of how we can make a yoga practice accessible to individuals with a variety of mobility, with different balance and different diagnoses. We're able to make a yoga practice work for anybody that's interested. Can we go to the next one? And this is how we do that. So the way we make yoga or we adapt yoga is we use different pose variations and we use props to help support these poses. So the pictures that you see here are the same pose, just done in different ways based on somebody's mobility considerations. So the very first picture is what we would call a traditional tree pose. And then in the second picture, you see she's using some support. Maybe she has some challenges with balance. In the third picture, she's doing the same pose or a variation of this pose seated, which might be good for a wheelchair user or somebody who's having some balance challenges. The last pose, the second to last pose, she's seated on the floor and she's using some props, a yoga strap to help hold her leg in place. And the very last one, she's lying down. So that might be appropriate for someone in a hospital bed. They can still practice yoga, or even somebody that might want to just practice a little bit of lying down yoga before bed for the relaxation benefits, for a little bit of stretching and movement before you get into bed at night. Okay, I can go to the next one. And here's just another quote in terms of, questioning the need for flexibility to do yoga. So yoga has been widely shown to increase flexibility. So a lack of flexibility only gives you more reason to practice. And so, I've heard this compared to people saying, oh, I'm, too dirty to go take a shower, but that's exactly why you're going to go take a shower, because you're dirty. Same idea. You can't say I'm not flexible enough to do yoga, because yoga is going to help you with that. It's actually a great reason to come to a yoga practice. Go ahead to the next one. Perfect. So again, just a quick review of those benefits that we talked about. And if you go to the next slide, we're going to start to dive a little bit more into these different benefits. Perfect. So the first one we're going to take a look at is increased flexibility. So when we talk about some of these benefits, I'm going to talk about them in two different ways: the physical portion of the benefit, and then also the mental or sort of psychological benefit that you might get, because a lot of these cross over and apply to both. So increased flexibility we've talked about, and physically that's going to be range of motion of the joints and stretching out tight muscles. This is really great to address rigidity and posture that we might find in Parkinson's disease. It also helps us to avoid injury. So especially if you do anything that has sort of a repetitive movement that you do over and over and over again, this really helps to keep everything balanced. So physical flexibility and range of motion of the muscles and joints, but then it also helps to develop a mental flexibility. So being present, open to trying something new. There's a whole lot of really great mental flexibility options that you can carry over beyond the yoga practice. So you can develop them and practice them in your yoga, but then again, they carry over into other areas of your life as well. You can go to the next one. Increased strength. So physical strength, strengthening the muscles, using muscles that you might not use very often. So we all get into habits and patterns. And so we're strengthening and moving and using the same muscles over and over. But that often means that there's certain groups of muscles that we're not using as regularly. So for example, a lot of people have strong muscles in forward movement. So the movement and the muscles that they use to go forward, because that's the plane and that's the world that we live in. We don't do a lot with our body side to side. So oftentimes when I'm treating people, whether in physical therapy or doing yoga with them, we find a lot of weaknesses on the muscles on the side of the body, which are really important stabilizing muscles that can help decrease risk of fall. So yoga can help to balance out your strength by working some muscle groups that you're not often working. We also can talk about mental strength. So working through challenging poses or positions or building up a meditation practice can really help to build a mental strength as well. And again, when we talk about strength, physical strength, strengthening the core muscles and strengthening the muscles of the back can really help with any sort of posture impairment that we might see with Parkinson's disease, to decrease that rounding forward or the forward lean that might come with a Parkinson's, and the tightness and the rigidity of the front of the body. Strengthening the muscles of the back of the body can even out that imbalance and help with an upright posture. Go to the next one. Balance and coordination. So we're going to get physical balance and coordination by doing standing yoga poses, but also, like we just talked about, if you're strengthening the muscles of the legs, the hips, the core, the feet. So oftentimes we don't think to strengthen our feet, and many yoga classes are done barefoot. If you go to a yoga studio or a gym, they might be done barefoot, which is really great to strengthen the muscles of the feet, which I think we often forget about. But the foot muscles are really important for our balance. We're also going to help prevent injury or decrease risk of fall by working on physical balance. And then again, balance in the body between the right half of the body and the left half of the body. Most people have a dominant side, but yoga can help to sort of bring a little bit more balance. And then the upper half of the body and the lower half of the body. So again, if you're someone that's really strong in their upper body, you've done a lot of lifting, you've done activities that have kept your arms strong and your legs are maybe not quite so strong, yoga can offer a well-rounded movement program that can help you strengthen the muscles and bring a little bit more balance between right and left or upper and lower. We also want to talk about balancing strength with flexibility. So they're both important, but they need to be done in balance. So if the front of your body is tightening up because of the rigidity, we want to stretch that, but then to help maintain that, we want to strengthen the back of the body. So that's that balance that we need to find. There's also a mental and physical balance of just balancing stress, working our body hard to the point of fatigue, and rest, recovery. It's just as important. So yoga can offer that because you can have the physical, more challenging yoga practice, and then you can balance that with a breathing and a mindfulness and more of a relaxation or a restorative yoga practice to help the body recover. So it offers some different things that you can do. And we'll talk a little bit more about that when we talk about the different types of yoga, because the different type of yoga can offer different benefits. We can go to the next one. And improved breathing mechanics and gas exchange. So the most important piece with this is going to be a muscle we call the diaphragm. So a little later on, we're going to go over what we call diaphragmatic breathing. And the diaphragm muscle lives right below our ribs, above our abdomen, below our ribs and lungs. That's the muscle that should be our primary muscle of breathing. Now, for most people, it's not. Most people become chest breathers, and we use all these muscles around the upper chest and the neck to do our breathing. If we strengthen that diaphragm muscle, you can let all of this relax, and you're going to actually get better oxygen exchange. You're going to pull the oxygen in more efficiently, and then that muscle is going to help release the oxygen as well. The other really great benefit of the diaphragmatic breathing is that it can evoke a relaxation response, which is one of the ways that yoga can contribute to reducing stress and anxiety and help manage pain. And the way that it does that is that in this diaphragm muscle, the diaphragm muscle that lives right under our rib cage, right below the lungs, a nerve called the vagus nerve goes right through that muscle. And so every time you take a good diaphragmatic breath and engage that muscle contracts, and it's going to stimulate that nerve, which works on a portion of our nervous system that has a relaxation response. So just by incorporating this type of breathing into your day and into your yoga practice, you can actually have a relaxation response, a calming effect. And for a lot of people with Parkinson's, this actually really helps with managing tremor as well, having this relaxation response related to the diaphragmatic breathing. So diaphragmatic breathing is a really great tool, and we are going to go over that together a little bit later. Go ahead to the next one. So yoga can help with stress and pain management. So we just talked about how the relaxation response with the diaphragmatic breathing can contribute to that. But yoga also focuses on pain-free movement. So yoga does not subscribe to the idea of no pain, no gain. We can adapt our yoga practice, like I showed you before, with the use of props, with the use of pose variations, to make it accessible to a wide variety of people to practice in a pain-free and safe way while still experiencing the benefits of yoga. Yoga can also help alleviate muscle tension. So we know a lot of pain comes from tight and tense muscles, muscle spasms. So the movement and the stretching can help with muscle tension and increase tissue extensibility. So that just means all of the other tissue around the muscle is going to get some movement. And if all those tissues move better, overall, they're going to have less restriction. And the restriction is generally what causes pain. And then there's emotional, mental stress and pain that yoga can help with. And so yoga and meditation have been found to be effective tools for managing stress because, again, you're using the breath to help regulate our response to stressors. And the meditation and mindfulness practice helps you, if you're present in the moment, you can better regulate your response to different stressors that come about in your life. So the breathing and the meditation practice are the pieces that really help with this emotional and mental stress and pain that people deal with. We'll go down to the next one. So I have a couple of studies here that are specifically about the effects of yoga on individuals or with individuals with Parkinson's two studies that were done, I have here. Both of them, their intervention or what they did with the group was 60 minutes of yoga twice a week, and it was a 12-week program. They did have a group of participants that did not participate in yoga as a comparison. So they were able to see the difference between the group that participated in the yoga and the group that did not participate in the yoga. And overall, they found significant improvement in scores on the Unified Parkinson's Disease Rating Scale, which is a scale that's used. It's an outcome measure that's used to evaluate different aspects of Parkinson's disease, both motor and non-motor, and the effect on the individual's quality of life. So they found improvement with that. And they found improvement with the Berg Balance Scale, which is something that we use often in physical therapy to assess someone's balance and risk of fall. So they improved their scores. They also found a general trend of positive outcomes with range of motion, strength, and flexibility, qualitative improvement in postural alignment. So essentially that means they didn't measure it necessarily, but overall people were demonstrating better posture. And the thing that I found really interesting about this is they took measurements of these participants at the start of the study, 6 weeks into the study, and then at the end, 12 weeks into the study. And they found the most significant change between 0 weeks and 6 weeks. So by 6 weeks, they had really started to have some noted benefits and improvement. So it only really takes 6 weeks to start to experience some of these benefits of a yoga practice. We'll go to the next one. And these were the subjective reports. So these are just, they asked the participants, what positive and or negative effects did you experience as a result of doing yoga? So these are not measurable necessarily. They didn't measure these. They just asked everybody, what did you feel? And everybody reported, or most people reported, an increase in flexibility, a decrease in muscle tension and stiffness, increased steadiness with gait and balance, and an overall improved level of functional activity. The other really interesting thing is that nobody reported any negative effects. So there was really not much negative to report about participating in a yoga practice. Go on to the next one. So this second study is similar. They did 60 minutes of yoga twice a week for 12 weeks. And the yoga included the physical yoga poses, breath work, breathing, and meditation. And same thing, they saw a significant improvement of scores in the Unified Parkinson's Disease Rating Scale, an increase in the average forced vital capacity. So what that is the amount of air, if you take a full inhalation, it's the amount of air you can forcibly exhale after you take that inhalation, and they can measure that. So they found an improvement with that, and they found improved diastolic blood pressure. They also found a positive trend of improvement with depression scores, body weight, fear of falling, and the forced expiratory volume. So one of the interesting things about falling, the fear of falling comment is that there is a correlation between fear of falling and actually having falls. So if we can decrease someone's fear of having falls, they actually are less at risk for having a fall. Participants also reported an immediate reduction in their tremor, an overall increase in participation in physical activity, and actual decreased decreased rate of falls while participating in the yoga program. And again, in this study, they found the most significant changes were noted when they did that 6-week assessment. So it only took 6 weeks for them to really be seeing some of these results, some of these benefits and changes. All right, so we'll go on to the next one. All right, so hopefully this all sounds good so far and that you're interested in some of these benefits that yoga has to offer, but how do you do this? How do you get started with a yoga practice? We'll go on to the next one. So some things to consider to find the right class. You want to consider the type of yoga because as I mentioned before, there are many. And the next slide I'm going to show you is going to outline or give you a list of the different types of yoga. You want to consider the teacher. So does this teacher have experience teaching this type of population? So there's many, many fabulous yoga teachers out there, but everybody has a different specialty. Some people are comfortable teaching, individuals that have a neurological diagnoses and considerations. Others might say that maybe they're not the right teacher for this population. So you want to look around and make sure you find a teacher that either has experience or is comfortable teaching what you're looking for. And then you want to consider the type of environment that you're interested in trying yoga. So do you want to actually go to a yoga studio? Do you belong to a gym that maybe offers some yoga classes? There's a lot of online yoga classes being held right now. Senior centers, community centers, there's a lot of places offering yoga right now. So you want to take into consideration the environment that you're going to feel most comfortable in, and what those differences might mean. So if you go to a traditional yoga studio, chances are, like I said, they might practice yoga barefoot. So do you want to be barefoot, or do you want to keep your shoes on? Where if you go to a community center, they're likely just going to have you keep your shoes on for the practice. Do you want to be online, or do you want to be able to maybe interact with the teacher a little bit more and be in person? We can go on to the next one. So this is a little bit of an overwhelming slide, but really I'm just sharing this to give you an idea of how many different types of yoga there are. And so if you look on a website or a class schedule and it just says yoga, that's not a lot of information. You really need to get a little bit more information to know if it's going to be an appropriate class for you and it's going to, give you the benefits you're looking for, because yoga means a lot of different things. So this is really just giving you an example of how many different things. And if you go to the next slide, we're going to talk a little bit more about how do you sort of dig through that information and find the right class. So first, consider what you're looking for out of the class. Do you like the idea of the stretching benefits? Are you looking for more mobility and, more flexibility? Are you looking for the relaxation and the mindfulness benefits? Do you want to stand during the class, or do you want a class that's going to be fully seated? Do you want to have to get up and down off the floor? So you're going to think a little bit about what you might want to get out of the class. And then when you start looking at some classes, there should be a class description somewhere. So if there's a website that you're looking and they're offering some yoga classes, there's hopefully a little bit of a description that's going to give you some more information. It's going to tell you this class is fully seated, or this class you are going to have to get up and down off the floor. There's heated yoga. So it might say this class is held in a 105-degree room, in which case you might say that's not what I'm looking for. Or this class focuses on breathing and mindfulness and relaxation. So a class description should give you a little more information to help you get to the right class. But if there's not more information, just contact the studio or the gym or the community center or wherever it is that you're looking at a potential class, and just ask them. Let them know what you're looking for. Let them know any concerns that you might have about beginning a yoga practice, and they should be able to point you in the right direction. So for example, some of the yoga studios that I've taught at, if somebody calls and says, I have Parkinson's, but I'm looking to start yoga, they might say, try Danielle's class. She's a physical therapist. She has a lot of experience in this. She'd be a great fit. Her class was exactly what you're looking for. So if you call and ask some questions, they should be able to help point you in the right direction to get you to the right class. And then also ask for recommendations, whether you know other people that practice yoga, whether you know yoga teachers, ask for some recommendations, and then be open to trying some different things. Because the first yoga class you go to might not be your cup of tea, but there are so many different styles of yoga classes. There's so many different yoga teachers that are all going to present and teach stuff differently. So if you don't find a perfect fit on that first try, I hope that you'll continue to practice that flexible mind that we talked about, and maybe try again. Maybe try another class and see if you can identify what it is you're looking for and find a great class that you're going to enjoy. And we can go on to the next one. Okay, so some things to think about before you go to a yoga class. Like I mentioned, yoga is often practiced barefoot, but not always. So if that's not something you're interested in, just make sure that you find a place that is okay with keeping your shoes on. Many yoga studios don't even allow shoes into the studio space. So that's going to be some place that you wouldn't want to go if you really want to make sure you keep your shoes on while you're practicing. Ideally, you're going to want to turn off your cell phone or keep it somewhere where it's not going to interrupt you during the class. Because again, we're practicing mindfulness and being present in the moment. And there's nothing to take you out of the moment like a cell phone. And then props. So we're going to talk about props on the next slide, but props are your friend. A lot of people think props are just for beginners or because you can't do something. Props are a really great way to help make yoga poses accessible. So if you are going to be practicing at a yoga studio or a gym, they're likely going to have props there available to you. If you're going to be practicing at home and it's something you begin to enjoy and want to practice regularly, you might want to look into getting some props for yourself at home. And then if you're new to yoga, you might want to let the teacher know because they might be able to give you some extra tips. They might be able to provide you some feedback. Or come over and make sure you know how you're using the props. So just let the teacher know if it's your first class or if you're still new to a yoga practice. And then really listen to your body. So yoga is, again, at its nature, it's an adaptable movement practice. So it's really up to you to notice how it feels. Yoga doesn't do no pain, no gain. So if you're feeling some pain, that might mean that you need to make a little bit of a change, adapt something a little bit so that you're not having pain or discomfort, but really sort of do what feels comfortable, do what feels right. Make that yoga practice your own. You don't need to look exactly like the person on the yoga mat next to you or in the chair next to you. Yoga really should look different on each person. So we all have different shaped bodies. We all have different movement and experience with movement and pain. So yoga should look different on every different body. And then, like I said before, I encourage you not to give up. If you go to one yoga class and you don't love it, I encourage you to try another one because they all are very different. And that first one you go to might not be, exactly what you're looking for. But oftentimes I do hear people say, I tried yoga once, I didn't like it. And so yoga classes can be so different from person to person and different settings. So please, keep an open mind and try again if you don't find it on the first try. We'll go to the next one. So yoga props, you've heard me mention props several times, and these are really important when we're talking about adapting a yoga practice. So oftentimes you'll go to a yoga studio and you'll use a yoga mat. The only classes you probably won't see a yoga mat would be a chair-based class. So a chair yoga class, they're likely not going to use a mat. But the mat gives a little bit of cushioning. So if you're seated or if you're on your hands and knees, it's going to give you a little cushioning. And then it's kind of got a grippy surface so that whether you're standing or you're on hands and knees and your hands are down, it's going to give you a little grip, a little bit of traction. So it's not going to be slippery. Yoga blocks are a really great tool. So they're foam or cork blocks that you use that you can put your hands down on, you can put underneath your knees. There's all sorts of ways that we can use blocks in a yoga practice. You might see blankets or bolsters, so like big cushions or pillows. And again, they're used for extra cushioning, maybe underneath your knees if you're on hands and knees, or to fill in some space in a pose or position. So that you can tuck a blanket or a bolster into somewhere to give you a little extra support. Yoga straps might be used to hold a pose in place. So you can use a strap, put it around your foot and hold that position. The wall is a really nice yoga prop that I think people don't think about, but if you have a wall nearby, it can be used for support. So if you go to a yoga class somewhere and you have any concerns about your balance, just pick a spot in the room that's next to a wall, and then you've automatically got some extra support. You can reach out and hold onto the wall if you need. And then chairs. So you're always going to find chairs in a chair yoga class, and it's going to provide a seat for seated poses, but also can provide some support in standing. And then if Bill wants to flip to the next page, we'll see some examples of the props. So this is the slide we looked at the beginning, and you can see she's using all of the different props we just talked about to help make these positions accessible. So she's standing using chairs for hand support, and she's got her foot on a block in some of these pictures. She's also using a yoga strap in the fourth picture. So she's using it to kind of hold her leg up in place. And maybe if she doesn't have a lot of trunk strength, she's using it to hold herself up. She's got a wall behind her in the seated position, which is again being used for support. And then in the lying down one, she's got a little bolster underneath her head that she's using as a pillow. So there's all different ways that we can incorporate props into our yoga practice so that we can best support it and make it accessible. So the props really are such a great and I think underutilized tool in many yoga classes. But if you learn how to explore and use the props, it really can open up the accessibility of a lot of yoga poses. All right, and we'll flip to the next slide. So we're gonna do a very short, maybe no more than 10-minute seated yoga practice. It's going to be seated the entire time. We're not gonna stand, we're not gonna go to the floor. And remember, so some quick things. Remember that yoga does not subscribe to no pain, no gain. So it's up to you to really feel the movement and stay in a range that does not increase any discomfort. So I'm going to be giving verbal cues and demonstrating, and you're welcome to follow along with me. But again, make sure that you're staying within a comfortable range for your body and only do what really feels right for you. And if you're not feeling up to participating in the yoga practice today, you're welcome to just observe and take it all in and get an idea of what it is that we've been talking about. And then maybe you'll be a little more open to trying it next time. So I am going to go ahead and let's see, there we go, perfect. All right, I'm gonna slide away from the computer a little bit so you can see me, and I'll make sure to keep talking loud. Okay, so first thing we're gonna do is review that idea of the diaphragmatic breathing that we talked about. So your diaphragm is if you trace your ribs up and they come to a point right here above the abdomen, you're gonna place one hand right there. Then you're gonna give a quick sniff. So just sniff in really quick, and you should feel a muscle pop into your hand right there when you do that little sniff. And then you're gonna take your other hand and place it on your upper chest. So what we're gonna start with is just some breathing. You're welcome to keep your eyes open and watch, or if you'd like to close your eyes and just listen to my voice, you're welcome to do that. We're gonna inhale, and as you inhale, you should feel this bottom hand, that muscle push into that hand. So as you inhale, that hand puffs out, and as you exhale, that hand falls a little bit. The top hand on your chest should feel still. You don't want to be using the chest muscles for breathing. So we're going to take just a few breaths. Two more breaths here, and then we're going to bring some movement. Relax the arms down to the lap. So right at the beginning, we talked about how in yoga, we like to think about linking our breath with our movement. So we're going to start that with just some shoulder shrugs. So as you inhale, you're going to shrug your shoulders up. As you exhale, you're going to lower the shoulders down. Inhale, shrug up. Exhale, lower down. Inhale, shrug up. Exhale, lower. Good, two more. Inhale, shrug the shoulders up. Exhale, lower. Inhale, shrug. Exhale, lower. Good. We're going to add on. So we're going to inhale, reach the arms up overhead, big stretch up. Exhale, lower the hands down. Inhale, reach the arms up. Exhale, lower. One more just like that. Inhale, reach the arms up. Exhale, lower. Good. This time we're going to inhale, reach the arms up. Right hand is going to come down to your right hip. And then you're going to take a bend over to the side. You should feel a stretch down the side of the body. If this causes any shoulder pain, you can bring the arm down, but still do that little side bend stretch. So this is where it's up to you to check in and see how that feels. And then the next inhalation, you're going to reach the arms up overhead and bring the other arm down. And we'll side bend in the other direction. Inhale, bring both arms up overhead, and we'll exhale, bring the arms down. Inhale, bring the arms up overhead. We're going to bring the right hand to the left knee and the left hand down to the side, and you're twisting your body to the left. So you have the option of adding some neck movement here. So if you have any neck pain, you might want to take a pass. But if your neck feels good today, as you inhale, you're going to look towards your front shoulder. And as you exhale, you're going to look towards your back shoulder. Inhale towards the front. Exhale towards the back. Inhale to the front. Exhale back. And then we're going to unwind from that twist, reach the arms all the way up overhead. And we're going to do the opposite. You're going to bring left hand to right knee. Right hand's going to come to the side of the chair, and you're going to rotate to the right. You can stay here, or you're welcome to add the neck movement. So on your next inhalation, you'll look towards the front shoulder. And then as you exhale, you'll look towards the back shoulder. Inhale, front. Exhale, back. Inhale to the front. Exhale, back. We're going to unwind. Arms are going to come up overhead, and we'll lower the arms down. I'm going to turn to the side so you can see my back a little bit better. So for this next movement, I'm going to have my hands start out by my knees. As I inhale, I'm going to lift my chest and lift my chin, pull my shoulder blades back. And then as I exhale, I'm going to round my spine. Inhale, lift my chest, lift my chin, pull the shoulder blades back. And then as you exhale, round. We're going to do two more just like that. Inhale, pull the shoulder blades together. So we're strengthening the posture muscles of the back. Exhale, round. One more. Inhale, pull them back. Exhale, round. And then we're going to come on up. One last stretch we're going to do for the legs. Tilt that down just a bit. You're going to extend out your right leg so that your heel is on the floor. Sit up really nice and tall. And then you're just going to lean forward a little bit until you feel a gentle stretch down the back of the leg. So again, gentle stretch, not going to the point of pain. If you felt pain, you might want to back up just a little bit. And we're going to take a couple breaths here, getting a nice gentle stretch in the back of the leg. And we'll come on up, and we're going to switch sides. Extend out the other leg, heel on the ground, sitting up nice and tall. And you're going to lean forward just a little bit until you feel the stretch down the back of that leg. And we'll slowly come up. And we're going to finish up with just a couple of minutes of a mindfulness practice. So one of the ways that we learn mindfulness and meditation is by using what we call an anchor, something to focus your attention on so that you can stay present in the moment, focused on that anchor. So for today, our hand is going to be the anchor. So what we're going to do, you're going to take the pointer finger of one hand and bring it to that bone on the outside of your wrist on the other hand. Give your fingers a wiggle and really begin to focus on that hand. We're going to trace our hand, matching it with the inhalations and the exhalations. So as you inhale, you're going to trace up the outside of the finger, really noticing that touch. And as you exhale, bring it down. Inhale, trace up the ring finger. Exhale, trace it down. Really paying attention to the feeling of your finger on your hand. Inhaling up the middle finger. Exhaling down. Inhaling up the pointer finger, exhaling down. Inhale, you're going to come up to the tip of the thumb. And as you exhale, trace all the way back down to the wrist. Bring that hand down. Notice if you feel a little sensation of the outline of your hand that you just traced. And we're going to do the other hand. So bring the other hand up. Pointer finger to the bone on the outside of the wrist. And we're going to inhale, trace up the pinky finger. Exhale, trace down. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. Inhale, you're going to come all the way up to the tip of the thumb. Exhale, trace it down to the wrists. Place both hands down on your lap. Maybe close the eyes for a minute if it's comfortable and just notice that outline of your hands. Notice how your hands feel. Notice your breath. And if your eyes are closed, we'll slowly open them up again. And I will pass it back over to Bill to see if he has any questions that he'd like us to go over quickly before we finish.
Sure. Thank you so much, Danielle. Great job today. Apologize for all the challenges we had with some of the sound early on. And I'm glad that we were able to resolve that pretty early within today's presentation. But I have a couple questions that we've taken. The one question that we have, which is a great question, is do you recommend taking additional carva dopa, levodopa before doing yoga? I've taken yoga classes, but had lots of shakes and tremors during the poses, which was really exhausting and also a bit challenging. Any suggestions on that?
So technically as a physical therapist, I can't recommend, I can't make recommendations with medication. So I think that That's a great question for one of your other healthcare providers that helps manage your medications. And if you know sort of how the medication does affect you in terms of the timing, then it might be helpful to be taking it closer to participating in a yoga class. But one of the things that I say to people, and I tell them this in physical therapy as well, is sometimes it's good to practice these things in different situations. So when you're having more of the tremors, because in real life, that's what you're, moving around and dealing with. So it's good to practice some of these movements while you're dealing with the tremors. But your either your neurologist or one of your healthcare providers that manages your medications might be able to advise you in terms of timing the medications with participating in a movement activity like yoga.
And the other next question that I have is, hard to do standard yoga poses ever since about with knee osteoarthritis pain. Are there poses that you would recommend to help with the knee pain that I have?
Yeah, so one of the great things about yoga is, like I said, if you find the right class and use props, you can modify those poses in a way that you're not going to be increasing or causing your knee pain. So if you're going to be doing any kneeling, blankets really underneath your knees are really comfortable to give a little extra padding. If you're doing standing poses, the best thing to do is to decrease the intensity or the range of the position. So for example, if you're familiar with, it sounds like, someone who asked the question has some experience with yoga, but if you're doing a standing lunge type of position, if you decrease the length or the space between your legs, and then don't bend that front knee and drop as far down into the position, you're not going to be putting as much load onto that joint. So the best thing to do is sort of decrease the range or the intensity of the pose and use props.
Yep. Next question, are yoga straps the same as the resistance bands used in physical therapy?
They're actually not. So the straps don't have any sort of, resistance or give to them. They're like a nylon strap. So there's no stretch. And so the difference is going to be that it's going to actually help stabilize you a little bit more versus if you put the resistance band from physical therapy, around your foot to use it to hold your foot in place, those bands have give and they're going to move and they're not going to give you that support and stability that the strap would. But if you don't want to have to go out and buy a yoga strap, you can use a towel, a belt, a dog leash. There's all sorts of things that you can probably find around your house that can supplement for yoga props. So even yoga blocks that we talked about, some books work great. Shoe boxes work great. There's all different things that you can supplement for yoga props and not have to go out and necessarily spend the money to get something specific.
Thank you. So just a few additional things to close out today's presentation. First, I want to thank Danielle for a great presentation. We've gotten some great feedback along the way during today's presentation on all of the components, and it's been incredible information. Certainly this type of exercise is critically important, not only for those with PD, but also to help us navigate through the pandemic, especially the relaxation component of it. Mm-hmm. I just want to give a couple of pieces of information. We have information referral centers dotted all over the United States, one of which is here in the Boston area at Boston University Medical Campus. Phone number 617-638-8466. We help with referrals and resources. We've got education and support all over the country. We also provide health and wellness programs, not only virtually, but in person. We have a fitness professionals training program, as well as National Rehab Center here in the Boston area. One last thing is we have social media. Very important for you to follow us on social media. Here are the social media accounts in Massachusetts, Twitter, Facebook, Instagram, and our website. If you have any questions, please reach out to us. We'll be sending out today's presentation with some additional resources. We very much appreciate Danielle's presentation today. Great content and great information. Thank you, Danielle, for everything that you do for APDA and the Parkinson's community. And we hope that everybody has a great day today. So thank you very much.